think I'm on. Welcome, everybody. Just give me a quick moment while I get Instagram set up. All right, I'm on Instagram. Hi, how's everybody doing today? We're streaming on YouTube, on Facebook, on Instagram as well. I see 14 people on with me. Got lots of comments already coming in. I'm going to be talking about hip pain today. With hip pain, there are a lot of things that could be done, a lot of things that could be affected as well. So when it comes to hip pain, it's kind of fresh for me. I'm starting to get a little bit of hip pain myself. Um, I've been I've been running a little bit more. I've been lifting heavier weights. Nothing big, nothing that was an incredible jump. And the pain isn't bad either. It's really minor, and it actually went away already. I'm just being safe, being cautious. I had hip pain for one day after a long run last week, and I was just acutely aware of it. And here's what it is. I think I aggravated my labrum on my right hip. That's a piece of cartilage inside the hip that's really important. Um, and I feel twinges from time to time. Um, every other day since last week, and it's been getting better and better. And even last week, it wasn't super bad. It was like I could still walk, I could still do stuff. I felt like I could go exercise. I'm just acutely aware of it because of what I do for a living. I know this stuff, and I've been working out my glutes. I've been working out my glutes anyway, but I've just been focusing my glutes. And so part of my workout today is going to be kind of like a rehab workout, if you will. I've been working out already. You can see I'm already sweaty. I'm going to be doing deadlifts still because I love deadlifts and they're really good for glute activation. And then I'll be doing some sit-ups on that mat, and then I'll come back and do some calf raises here. And the reason why I've modified this workout, or the way that I've modified the workout so that it's like rehabilitative, is I'm not going to be going heavy and hard, heavy on the weights and aggressive with my sets, because I'll do heavy weight like over 300 pounds, and I'll do sets of 10 or more sometimes, like 10 reps or more. I'll see if I can get to the 15 or 20 reps. And my muscles feel good doing it. I feel like I can lift it. My grip is actually what gives out first before anything else. But I think I've just ramped up the weights a little too aggressively for the cartilage in my hip to catch up, because cartilage will get stronger if you load it with forces gradually in the right intensities and then give it enough rest time. And I think that was my mistake, is I just didn't give myself enough rest time, because I was going from heavy weightlifting to long distance running back to heavyweight lifting. And because I love being active, I love exercising, but I'm also going to listen to my body because I want to be able to exercise tomorrow and the next day. I actually exercise just about every single day. There'll be maybe a couple days a month that I miss, but anyways, so when I pick up the heavier weights, I'm sharing this because it might help some people out there when you're doing exercises. And I'm saying I'm doing 300 pounds plus, but you can make it relative to you, because I'm thinking of an intensity scale of 0 to 10. How intense is this exercise for you? For me, picking up those heavy weights, it's like a 9, close to a 10, 9.5. I'm going to keep my intensity here today under a 5. I'm still going to sweat. I'm still going to burn calories. I'm still going to feel my muscles work, but I'm not loading my joint. I'm not loading my cartilage, the labrum of my hip, aggressively with a lot of force. I'm not even doing high reps. I've been doing sets of 10 instead of sets of 20. And here's the thing. This is what I think, how this ties into the muscle imbalance concept that sets up hip arthritis, hip bursitis, tendonitis, labral tears, other hip problems, like hip flexor tendonitis. Like, people get pain in the front of their hip as well in your younger years. Here's the thing. If you do more intense exercise, either in weight, like it's heavier resistance, and whatever's heavy for you, picking up a 10-pound weight might be very heavy for you. So if you pick up heavy weights, or if you do a lot of reps, like I was running miles and miles, So I'm sustaining motion for a long period of time, because you can build up intensity that way too. If you're doing that, then you're going to possibly set up a aggravation to the cartilage, to the bursa, to the tendon, to the joint in general, to the muscles. The harder, the more intense you go, the more likely you are to hit the limit of what your tissue can take, number one. And then number two, especially with like heavier exercises, you're more likely to co-contract. Big word for, let me just say it really simply. When you co-contract, it means more than the intended muscle group is firing. So like I'm doing deadlifts over here, thinking about my glutes working, but as the weight gets heavier and heavier and heavier, I'm still thinking about glutes, but everything has to help to get the weight up, to be able to lift the weight. And as you're running for a long time, if I'm psychologically telling myself, okay, 2 more miles, 1 more mile, another 10 minutes or whatever it is. And I'm thinking about just finishing, continuing the distance, getting to my starting point, getting back to my home or wherever I started running from, so that I can make it, but at the expense of my glutes working as good anymore. So just think about that. Your intensity, whether it's for like how long the endurance or how heavy, how resistive the exercise is. When you're trying to rehabilitate a hip problem, especially like a cartilage related problem, you need to it doesn't mean stop. I don't feel like I need to offload. I don't feel like I need to stop exercising. I don't feel like I need to get on a cane or a crutch or anything like that. I just need to tone it down a little bit right now, let myself recover, because normal walking feels absolutely fine. I can even walk a little faster. I feel like I can even go jog a mile or two and I'd be all right, but I'd be pushing myself too much if I run too fast or run for too long. So anyways, I hope that helps. Trying to give you guys some insight. And it's not just cartilage, this is the same thing for the bursa, same thing for the tendons. And those of you guys dealing with hip pain, just wanted to make sure I give you guys that information. I forgot to do a mic check with you guys. If you're watching right now, can you please just let me know you can hear me? I hope I didn't just talk for 7-8 minutes and nobody heard me at all. That would suck. I see comments coming in from different places. RNJO says, hello, blessings from Panama City Beach, Florida. Awesome. I can't wait to visit Florida again. I was out in West Palm Beach for a conference, and I got to visit Palm Beach. My goodness, that place is opulent. Very nice beaches as well. All right, you guys can tell me you can hear me. Ira says thumbs up. Daniel says yes. Fantastic. Thanks. Glad you guys can hear me. Marilyn says I can hear. All right, let's get to some questions here. And I'll see if there's one I can answer while I'm exercising. I've already been working out, so I'm okay to take a break right now, honestly. Let's see who's first here. Andrade says, is there anything one can do to reverse sarcopenia? Oh, absolutely. This is something we were talking about in the office today with Coach Raul and Coach Jay. Coach Raul was giving a teaching to our hip arthritis and our knee arthritis recovery groups. And it's a loss of muscle. The problem that healthcare professionals at large are giving you guys is that they're saying that it's age-related loss of muscle. And that puts you in a position where you feel like you can't do anything about it because it's age-related and you can't reverse your age. So reversing sarcopenia seems impossible for a lot of medical people, but it's really just gaining muscle. You have to go work. That's what it is, Andrade. You have to go exercise. You have to hit the gym. Your body will respond. Your body is a living physiological thing that responds to forces put on it. So if you go stress it in a positive way, meaning you're not hurting yourself, but you're challenging the muscles, you're doing it with mindful of muscle imbalances, then you will add more muscle, which directly reverses sarcopenia. We're talking about it in light of osteoporosis as well, because osteoporosis is when the bone, you start to lose bone. Essentially, the bone gets less dense, so your bones are less, they're more brittle, Your bones don't necessarily change shape, but they're just more prone to fracturing, to breaking. But it's because you haven't put resistance to your bones. And the more resistance you put on, the thicker they get, the more bone you'll put on. Your body just responds. If you don't use it, then you end up losing it with both muscle with sarcopenia and bone with osteoporosis. So get on it. There's a few conditions out there that will, like, health conditions that can set up sarcopenia more, or osteoporosis. But in general, if you're exercising and in a way that challenges your muscles, you're going to put on muscle and you're going to be reversing sarcopenia. Andrade has another comment. When I stand for long periods, my knees seem to lock up. Does that have anything to do with how I am standing? Should I be leaning my weight on my heels, the entire foot, or towards the front? It's a little more complicated than that, Andrade. I'm gonna shut this door a little bit. We have a garage door here and we're right by a busy highway. So you should be able to hear me. I have my wireless mic on. When it comes to how to stand so that your knees aren't locking up, it's more about your glute activation than anything else. If you focus on the glute activation, meaning when you're standing, see if I can get a better angle here. When you're standing up, you think about tightening glutes back here, and then with your feet, you're just gripping the ground subtly with your toes like this, subtly, not aggressively. And ideally, you should be putting even weight from the heel towards the toes. Your arches are going to be up, so you're not going to put weight through your arches onto, like, your arches shouldn't be touching the ground. Your arches are going to be lifted, especially if you press down with your toes. That's going to help distribute the weight more evenly on your feet. But you should think about that, and your knees shouldn't be locked out, because if you have your glutes more active, watch this. Watch my knees. If you tighten your glutes, knees kind of want to bend. That's what should happen. But if you're locking out your knees, then you're putting your glutes in a position where they're not going to work, and now you're actually standing in a quad dominant way. And if that's how you tend to stand, that is going to feed into a muscle imbalance where you're using your quads too much and you're setting up problems like knee pain and hip pain. I see a lot of very flexible people, tends to be women, that lock out their knees, especially if they wear any shoes that have heels, because the heels, when your heels are lifted up in nice shoes, it forces your knee to lock out. It makes it easier to lock out your knees. Your body just kind of wants to do that in order to keep your balance, and it turns off the glutes. You have to be very conscious to use your glutes while using heels. So the solution is, I'm not telling people not to wear heels. You girls got to strut your stuff, look nice and all that stuff. I mean, make sure you feel good in your outfits and your clothes, but have good toe strength and have good glute strength so that you can tolerate using the heels, and it's not a problem for you. In your case, Andrade, if you're not using any heels, you're just talking about walking, in flat shoes or barefoot, just don't be locking out those knees. Use those glutes and grip with the feet, with the toes, so you can put the weight evenly on your feet. Just letting you guys know here, I'm going to answer the next comment. If you're on YouTube, you can do a super chat and I'll bump you up. I'll answer you right away. I'm just going to go down the list of comments that I have on here. If you're on Facebook, I can see your comments and I'll get to it in order here as well. You can still put your comment in there. I'll be here for like 30-ish more minutes, and then I got to go. So I haven't been able to get all the comments. You guys are asking good questions, and I like to do a good job answering questions here, not just go really fast. All right, next one. Aish J. Hey, Dr. David, is it possible to reverse chondromalacia patella grade 2 with supplements and physiotherapy in your 30s? Oh, absolutely. I'm going to get on some deadlifts while I'm answering this one because it's appropriate. Chondromalacia patella is when you have a excessive pressure on the kneecap, and it's from quads that are too overactive, and so they pull up quite a bit, and then they're pulling the kneecap up into the thigh bone, and so they're just smashing the thigh bone, the kneecap into the thigh bone. And if you have overdominant quads, they're going to be activating even at rest. So that's why people that sit that have this muscle imbalance where they're using their quads too much, their quads, you have an increased resting tension. This is like a known scientific thing. When you work out more, when you use a muscle more, you increase the resting tension in a muscle. It just gets more firm, more toned. That means the muscle's pulling slightly more just sitting around doing nothing. So that's why you'll start to get a compressed kneecap and condylomalacia patella. If you fix that muscle imbalance by strengthening the glutes, it tells the quads, I don't have to be as active anymore. And you can start to take the pressure off your quads, which takes the pressure off your patellas, which starts to heal the cartilage. It allows more space in the joint, less compression of the patella on the femur, of the kneecap on the thigh bone, so that you can allow it the situation where it can heal without getting more and more compressed over time. I don't know what rep I'm on. That feels like 10. So completely possible to heal from condylomalacia patella. What you shouldn't do is nothing. So that's what I see a lot of people do, is they get told by the doctor, just rest, which is a good advice at the beginning, especially if you're very irritated, because you need to just calm the cartilage down, get it to not hurt while you're walking around and doing normal everyday things. And then as it feels more like you're better able to tolerate exercise, then you have to work on glutes. But I see a lot of people work on quads, which just feeds into the problem. So go work on your glutes. That's the number one thing to do. All right, next question. Marine, 35, female with condylomalacia patella. Been doing isolated glute exercises for a few months now in phase 2. Why do hamstrings, quads still hurt? And now my glute medius too with new glute exercises. Do I still continue? Well, if you're, okay, so your hamstrings and your quads hurt, I wonder how the knees feel though. That's because I wonder if your hamstrings and quads are maybe getting sore. You shouldn't be having pain in the muscle. If you have condylomalacia patella, you're usually having joint pain like behind the kneecap. So if you're still having pain behind the kneecap, then I would question how well you're using your glutes. I know you said you're doing glute exercises, but so let me just run through the scenarios here. If you feel like you're activating your glutes well, and when you go do glute isolating exercises, you do tire out your glutes, but you're still feeling symptoms in your knee, then you still have a ways to go. You still have to continue to use your glutes. They have to get stronger, because you'll activate the glutes, but then you got to get them stronger. Now that you've activated them, that's like milestone 1. They can turn on, they can activate when I tell them to, when I think about it. But now you've got to make them work and get stronger. You've got to tire them out. You've got to translate your conscious glute activation to walking, to weightlifting, to going up and down stairs, to doing a bridge exercise, doing a climb, whatever it might be. And you have to just consistently use your glutes. And then you'll hit the next milestone of now you've increased the strength enough in the glutes where they're the dominant muscle, and you've achieved balance. You're probably in the thick of that place right there where you figured out how to get your glutes active, but now it's just strengthening. And that time there's a range of time for it. Some people take a long time to go through that, to get the glutes strong enough to now be the dominant muscle where their knees are feeling a lot better. Some people do it really quick. They do it in like weeks. It just depends on how severe your imbalance is, Marine. But my advice to you is keep going with the glute activation. Avoid anything that's aggravating the hamstrings or the quad muscles, and absolutely the knee for sure. Something else that could be happening is you might just be getting stiffness in those muscles. You might need to massage them out. I mean, literally get like a massage gun, one of those percussion massage guns, the ones that look like a drill, and soften up those muscles. You might need to do that for several days, maybe a week or two, and pair it with the glute activation. And then you could use like a rolling pin type of thing as well. They have massage rollers that you can roll on your thigh. You could use like a tennis ball or a lacrosse ball, racquetball, those kinds of things as well. Just depends on what you can tolerate, what's best for you. All right, I hope that helps, Marine. Miss Kimberly. Kimberly, I don't think you've missed a live stream ever. I keep seeing you pop up every single week. So consistent. She says, hi, Dr. David and EPMPT friends. Thank you for helping us with a better quality of life. You're welcome, Kimberly. It's just me, but I'll pass the word on to my friends and let them know you said hello. Thank you, Kimberly. Monique Hall says, good afternoon. I had gel injections on Tuesday. I walked out fine. It's a lot of pressure and pain in my right knee. I can't walk on it. Please give some advice on what to do. Oh, I'm so sorry, Monique. So gel injections, just for everyone's knowledge here, she's probably talking about hyaluronic acid injections for the knee. So let me angle that down. And these are, they call them gel injections often, because the idea is they're supposed to put similar components that are inside the fluid of your knee. They're injecting that in, and they're supposed to put some space in there, and it looks like a gel-like substance. I'm glad you felt well initially walking out, but if you don't feel well now, there's a chance you could be having an allergic reaction. If this is your first injection, I would call the doctor's office and just let them know what's going on and see if they respond with that's normal, which is often the case. You might just get a little sore afterwards. Give it a few days, but it's not bad to call the doctor, now, so that if it gets worse tomorrow's Friday, and they're closed tomorrow or Saturday, you can at least, see if there's anything they can do. Hopefully it's not a reaction. Hopefully it's just a normal symptom of the injection. If that's the case, then don't be active. That could be something you're doing too. They'll usually tell you don't be very active. Just walk around what you need to for living, bathroom, eating, that kind of thing, but don't go on walks. Don't go to the store and walk around the whole store. You need to make sure that you take it easy for a few days, because they put something in your knee. You need to let your body adjust a bit, and that normal daily walking around will help you adjust so that you can begin to tolerate more stuff. And even if you do feel better soon here, which is the hope, Monique, is that what I would recommend is that you still go work on, glute activation exercise. Start with some basic exercises. I wouldn't go, get on a treadmill or go walk around the park yet. Just because you feel better, because maybe the injection helps, doesn't mean you're clear to go do intense exercise or even mild exercise if it's the wrong focus, if it's like quad-based exercises, thigh exercises. So go fix the muscle imbalance, please. That's going to set you up to take most advantage of the gel injection, because if you get some relief, great, you're feeling better, you're happier, hopefully sleeping better, feel like you can do a little bit more. Use that extra energy on the right exercises, because you still have an imbalance. You still have a root problem that needs to be addressed. Do we have any super chats? None yet. All right. No pressure, by the way, guys. I'm just wanting to make sure I don't miss anything. Stephen B says, greetings from Rotan. Pain-free. Fantastic, Stephen. Hopefully we helped you get there. Even if we didn't, I'm happy for you. Kimberly's got a question. She says, is bursitis the last thing to heal after I get my muscle balance in order? It differs, Kimberly. Everyone has kind of a different experience. It depends on your body type, your body shape, your genetics, your activities, your lifestyle. There's certain things that are just going to bother you more. So like, I'll tell you my situation. I'm tall, I'm 6'2", and I'm more torso than I am legs. And I tend to get back problems as a result. I manage it very well. I don't really get back problems on a consistent basis, but if I'm not working out the right muscle groups, that's where I start to feel back problems first, and then I get hip problems and then knee problems after that. I mentioned about my hip pain at the beginning of this call. I rarely get pains that stop me in my tracks, and I have to, take days off, because I'm just aware of it. I pay close attention and manage it. But if you're fixing your muscle imbalance, you're gonna start to figure out your body better. It's a learning experience, right? You're learning how to correct the muscle imbalances and what exercises you can do, which ones you should be doing and shouldn't be doing, which ones bother you, which ones feel good, but also where you start to hurt first, and then what starts to hurt next after that if you're not managing things correctly. So it's just a matter of getting to know your body. Sounds like you're on the right track, Kimberly. Who's next here? Donna Wood. She says, how do you treat trigger finger? That is a good one. So trigger finger is when the tendons here in the palm of your hand, the ones that bend your fingers here, they get thick, and then they get stuck within tunnels inside your hands, and people will usually have a hard time closing, and they can't open. They'll have a finger that's stuck. It might be different fingers. They call it trigger finger because it looks like you're pulling a trigger. But when you get trigger finger, you need to wear splints. There's a bit of a treatment approach to it. You need to strengthen the palm muscles in your hand. It's an imbalance. The reason why the tendon gets thick is because you're overusing the tendon, and those long tendons that run to the ends of your fingers, you're overusing those likely because you don't have enough strength in the palm of your hand. And so getting the palm muscle stronger is necessary in order to offload the tendons that go to the fingertips. So number one place to start is get like a stress ball, a ball you can squeeze in your hands. There's putty that you can use out there. There's all kinds of grip strengtheners, but you need to make sure that you tire out the muscles here, the base of your thumb, and then the muscles on the outside at the base of the pinky, because those are the muscles that close together to wrap around, and they help your grip quite a bit. They're like the foundation of your grip, and then your fingers come after that. But most people don't have strength here and then have a lot of strength out here, and that's what contributes to the trigger finger setup. So it's a whole process, Donna. Kind of hard to. I gave it to you in a nutshell there, but there's a lot to unpack. I got a lot of questions here. Eva says, how to treat numb hands and pain in the shoulder. Depends on what it is, Eva. If you've got numbness in your hands, it could be because of the carpal tunnel nerve. It's called the median nerve. It could be from the radial nerve. And then you have the ulnar nerve. There's three main nerves that come off the neck and shoulder area and make their way all the way down to the hand. Either way, I wouldn't worry about figuring out the nerve too much, because a common shared root problem for any numbness in the hand usually has to do with neck and shoulder problems. And it's usually that your shoulders are your upper trap muscles, the ones that make you shrug. Those tend to be weak. And when they get weaker, gravity just pulls them down and pulls your collarbone angles down. And that causes the collarbones to compress the nerves. Everything coming down puts tension on the nerves. The muscles that pull down can compress the nerves at the neck because they attach to the neck. So they'll start to compress the spine in the neck, and it can compress the holes where the nerves come out on the sides of the spine and the neck. So you can get the nerve that goes into your hands pinched in several spots just up here, and then you might still have shoulder issues that bother the nerve. And then depending on what's going on in your hands, you can also get the nerve pinched there. So my number one thing to start to do is shrugging exercises. So I like to have people up against the wall. You put your forearms up against the wall, and then you shrug your shoulders and hold it. And you got to shrug all the way. Like you can see where my shoulders are right here. The camera's kind of crooked. If you look at this, so let me just do it this way. If you look at the space between my ears and my shoulders here, when I reach up, I'm not reaching up all the way here. I know it looks like I am, but I can stand to go up even higher if I shrug. You see that? And it takes more effort, and you'll feel your shrugging muscles right here work when you go all the way up like that. So you have to get your shrugging muscles to work in the highest position, and strengthen it there. When you do that on a consistent basis, like multiple times a day, I tell people do a shrug exercise like this hourly. Like just hold it for 10 seconds, do several reps, 5 to 10 reps, where you're just holding for 10 seconds. There's easier ways to do it up against the wall, like I was explaining. But get your shoulders all the way up, because then you start to offload the nerves, and that creates space for the nerves so that you're not compressing them and causing tingling and numbness into the hand. So that's it in a nutshell. Let's see if we have any super chats here. Got a lot of YouTube comments, a couple of Facebook comments. Nope, no super chats. All right, who's next? LJ Hind. Is gentle cycling, like on an adult trike or a recumbent bike, good for knee and hip osteoarthritis? I'm 63. It depends on how you're cycling, LJ, because it can go either way. It comes down to which muscles you're using. When you cycle or use a recumbent bike, a trike or a recumbent bike, even walking, you're using an elliptical. It's possible for you to use those exercises, to do those exercises and use your quads more, the muscles on the front of your thighs. But it's also possible for you to do those same exercises and focus on using your glutes, your butt muscles more. And that's ideal. If you can use your butt muscles on any of those exercises more consistently and maintain it throughout the entire exercise, then you're setting yourself up to take pressures off the hips and off the knees, and then it's beneficial for you at that point. But if you're working out in a way that makes the quads work more, then you're adding more pressure to those joints. And you may not feel it in the moment, like while you're exercising, but you'll build up the muscle on the thighs, and that starts to add more compression to the joints over time. And usually people will say, well, yeah, I felt good when I exercised, even if they felt their quads work. But then they'll say, but later on in the day or the next morning, my knees were hurting. And then they're thinking, well, I feel good when I exercise, but it hurts later on. They start to connect it to something else that they're doing, when in reality it's that they've been working out their quads so much whenever they go on the stationary bike or on a recumbent bicycle or an elliptical, or even just walking. Same thing with the trike. So just be careful which muscles you're using. Use those glutes more. Don't want to miss any super chats. Nope, we're good. All right. RNJO. Need a swig of water here. Hello, blessings to you from Panama Beach. Okay, I read this one. Let me get further down in here. We got Victor next. Victor, oh, look at that. Hook 'em horns. I'm a Longhorn, graduated from UT. 50-year-old male. Sorry, race cars are outside. 50-year-old male, just found out my right shoulder has mild osteoarthritis, having pain and some loss in range of motion. Left shoulder is starting to feel the same. Very depressed. I'm so sorry, Victor. You gotta, oh man, there's so much to do here. I don't have any content that I can't remember making any content, any videos on YouTube about shoulder arthritis. Maybe I made one, but if that, I don't think I have any. So this is gonna be my first one. Let me tell you, you need to loosen up that joint first, and there's some easy exercises you can do. I would start by lying on your back. I do have a video showing this exercise, but it's for a different condition. Lie on your back, put your elbow on a pillow. So imagine I'm lying down, and then you're just gonna gently rotate your arm. You just need to gain mobility. So arm rotation like this, no resistance, don't get tired. You're just trying to get the ball and socket joint to loosen up. You need to be doing this like constantly. I mean, every 30 minutes, every hour. There's ways to do that. If you sit down on a table or in front of a table or a desk, and you just put your arm like that to almost like you're arm wrestling the air, just get some rotation. You're just trying to relax the big muscles of the shoulder and just gently rotate the shoulder as much as possible. That's like step one to get things to calm down. Using a sling, like one of those things like when your shoulders hurt, can actually be beneficial to offload the joint, because you have big muscles that have been over dominance. It's a muscle imbalance, and it's pulling the ball into the socket too aggressively in the wrong direction, and that can contribute to it as well. So if you get yourself in a sling, that's often relieving. It's kind of like getting on a cane if you have hip arthritis or knee arthritis. After that, you got to start doing shrugging exercises, because that's usually the weakest muscle in the shoulder that causes the imbalance. And so getting your shoulders to shrug up. And then you need to learn how to shrug as your arm reaches up, because all of us should be shrugging when we reach up. There's so many people that they're lifting weights or something, they're reaching up at home, and they don't reach up all the way. They just reach up like this, but look at the gap between my shoulder and my head. You should be shrugging every time you reach up, because that puts the best forces. It makes your shoulder work the way it's supposed to. And if you're not training yourself to shrug, then you're making your shoulder work inappropriately. You're putting bad forces on it, and this is what feeds into an arthritis situation. Hope that helps out. We have next here, Diane Lenz. I have no pain sitting or lying down. Upon standing, especially my right hip joint aches, feels weak, so can't stand very long at all. How to build some strength and stability? Let me understand this one again. I have no pain sitting or lying down, great, but standing, right hip joint aches, feels weak, can't stand very long at all. Okay, so this sounds like it's more in line with a labral issue, like what I was talking about at the beginning of the call here, of the live stream. The labrum in the hip is a piece of cartilage. So if you think of the ball and the socket of the hip, on the socket side, it's bone, and around the edge of the bone you have cartilage. That's a labrum, and that labrum is used whenever especially when you're standing up, because it adds stability to the joint. And one of the classic symptoms of a labral tear or a labral injury is pain when standing that you don't usually feel when lying down or sitting. It comes on more whenever you're standing. So if that's the case, you probably have a muscle imbalance. Glutes likely are weak. That's what sets up labral issues. But in the short term, you need to offload that hip. I would get on a cane or a crutch and make sure you don't do anything that aggravates it. Try to offload, put some weight on the crutch to your right side, on a crutch or a cane, so that when you take a step, you're not putting your full body weight on that right side. Actually, you should have it in your left side if it's your right hip. That way, if you think about it, if you take off like 25 to 50% of the weight to your hip while you stand and walk, and it doesn't hurt to do that, you can put some pressure through it, but not your full body weight. Like when you walk, then you're giving the labrum a chance to heal. So do that for some time. Meanwhile, build up the strength in the glutes and gradually wean off the crutch or the cane. Some people just need the crutch or the cane for a week. Some people need it for a month to 1 to 3 months, sometimes longer. Really, it's as long as it takes. If it's getting better and better week to week and you need 6 months, I say keep going. Why stop and have a surgery if you're getting better still and it just takes you 6 months? So you're going to be in crutches or a cane afterwards. You're probably going to be in a walker if you end up having a labral repair surgery. And they don't even do them that easily. You have to qualify. There's issues with hip labrum repair surgeries that doctors are concerned about. So that's my hunch here based on what you're telling me, Diane. Let's see if we have any super chats here. Nothing yet. All right. We're back to Victor, my Longhorn. Looks like, look at that cute baby there, that little kid showing his horns. Victor says, found some of your and other YouTube exercise videos, and it has helped, but still feel handicapped. I'm so sorry. Yeah, you had the shoulder issue. It's a process, and by the time it's arthritic, it's been going on for a long time, and you need to. People are usually afraid to go to the extreme of wearing a sling, but they need to. You need to wear a sling. That's often the thing that nobody wants to do. Even healthcare professionals don't recommend wearing the sling, but it's going to offload the shoulder joint and set you up to feel better in the short term so you can tolerate more exercise that's aggressive. And there is a point where it's bad enough that even doing conservative treatment like what I'm talking about here is not going to benefit as much, and you probably do need a replacement. But I think that it's not replacement surgeries are overdone in general. I'm not just talking about the shoulder, but the hip, the knee, they're overdone. people are not fixing the root muscle imbalances and they're going straight to the surgery, and the doctors don't know. They don't know about this stuff. They're not trained this way. They're trained in surgery. All right, next question here. I was hearing now I lost sound and video is not playing. Okay, I think that was from earlier. Angel A, I think I got time for like 2 more questions and I'm done here. Do I have any super chats? I don't want to miss you guys. I don't think so. Angel A says, hi, I have chondromalacia of the right patella. I'm wondering if I should prioritize stretching or strength training in order to improve and manage my knee pain. Good question, Angel. I'm gonna do this one on my sit-ups. Great question. Don't focus on stretching. Bad idea to focus on stretching, because if you're doing a lot of stretching, it doesn't fix a muscle imbalance, and that's what you've got to focus on. If you can get those glutes stronger, you're going to offload the kneecap and set yourself up to heal. But stretching is not a good idea because it doesn't make you stronger. It doesn't fix the muscle imbalance. Now, it might help you in the short term, and I'm not saying don't ever stretch. I'm fine if you stretch for a few minutes, but what I don't want you to do is only stretch and not strengthen. You still got to focus on strengthening. What I would rather you do besides stretching is massage. If you can massage your quads and your hamstrings, that's going to set you up to relax the quads, to relax the muscles that takes pressure off the kneecap, where the chondromalacia patella is. That's a much better use of your time than stretching. Again, I'm not saying stretching is bad. I'm just saying don't focus on it. There's way better things for you to do. All right, just a couple more questions, then we're done here, guys. Tata says, hello from Dixon, California. Fantastic. All right, next question here. Heinrich Fritz. So the last one I'm going to take, guys. Hi, Dr. David, 20-year-old male. I likely completely tore my ACL 3 weeks ago. So sorry, Heinrich. But I have hope that my ACL can heal. Yep. What kind of exercise would be safe for me to do without risk of re-tearing anything that's there? I would not be focusing on exercise right now if I were you, Heinrich. What you need to focus on, number one thing, get in a knee brace. A brace that has brackets and hinges, something that gives you stability. You need to get in a knee brace. Like, it's a must so that your ligament can heal. Second thing is you need to get on crutches, because you shouldn't be putting full body weight through your knee right now if the ligament's torn. Because your knee, if your ligament's torn, the ACL, it's a massive stabilizing ligament in the knee, and every time you put weight on it, you're just overstressing it. So if you take weight off of it, doesn't mean you have to take 100% of the weight off, but if you just take like 50% or 20% of the weight, whatever weight you can take off without it getting worse. So put some weight on it, but not so much that you feel like it's worsening or staying the same. It needs to be feeling like it's getting better and better day to day. And you might have a bad day here and there, but like definitely week to week, you should be feeling like you're getting better and better overall. I would do that for probably the first 4 to 8 weeks. So you said you're on week 3. You still got a ways to go. You still got another month to go. Bracing and crutching. Those are the 2 main things that I would do. A third, like, bonus thing that I would do is try to bend your knee, try to straighten your knee, maintain some range of motion. Here's where I would stretch. You know, I was just talking about how you shouldn't stretch for chondromalacia patella, but for a ligament tear, I think very light stretching is appropriate, because you're just trying to maintain the range of motion. Because you probably had some swelling. Your knee might not bend all the way, might not straighten all the way. That happens sometimes with ACL tears. And I need you to maintain your range of motion so that when you're done using the brace and the crutches, you're not fighting that battle then. You can kind of work on it right now. Then at that point, after that, you need to work on foot strength, on glute strength. There's a chance you might need to actually work on quad strength sometimes. Usually after surgery you do, but occasionally if you haven't had the surgery, if your quad's shut down, then you might need to spend a little bit of time activating your quads. But if you can activate your quads right now, which is very likely, if you look down and you try to clench your quads and they clench, don't worry about it. Don't worry about activating your quads and doing quad-based exercises. You're much likely more so going to need glute strength and foot strength to fix this problem. All right, guys, that does it. I got a roll here. Thank you all for coming on the call and for coming on this live stream. I will catch you guys next week. We're looking at maybe doing some pickleball next week. So watch out. Stay tuned for that. Bye, guys.